Well, it's almost 20 minutes to 6. It's the 14th of November, so I'm going to call the meeting of the Ayer Board of Health to order. I don't know where our other member is. We haven't heard from her. So if she doesn't arrive, I think it'll be a quick meeting.
I'm not getting any service.
So, on our agenda for tonight, the first thing is public input. There's nobody here for that. We have Neshoba Board of Health regulations, material, and a lot of this, I don't think, I probably need to read off all the food permits. These are just the ones that are she's starting.
Okay.
I think we have one of them is a change in Dan's Place in New Owner.
Oh, yeah, I heard that.
Yeah, Karen Baldolino. So, we can go to the first one that we have some violations, and this is not a new thing with this. This would be Mango Grill at 38 Littleton Road. We've had this, as I said many times, food products need to be covered. That's always something. Employees' bathrooms need to be fixed. The dishwashing machine needs to be at the proper level. Food products, date in the freezer, you know, you always have to put a date on that. Gloves need to be out. So this is not something unusual. We've had problems before. And let's see, we had, oh yes, here's a, we have 10 housing violation, it says, at 10 to 16 West Street. Oh, and here comes our late person.
I'm so sorry.
And there will be demerits, just for anybody watching. That's all right, we're already, we started.
We waited a little bit. We just started, just as you walked in.
What a day.
So you have units 10 through 16 on West Street?
That's what it says. It says remove the trash from the property within 7 days and contact me at this office for reinspection once it's done, and that's what it says. And of course, the owner is Mill Street LLC in Shrewsbury. Then this is just a food renewal of a permit for Wu John Medicine Shop.
Oh, John, did the things with like the ceiling tiles and all that stuff ever get?
At 174 West Main Street?
Yeah,
Wu John?
that's the Korean market.
at the bottom of the
Remember there
bridge.
was, we actually had a landlord come
that
in
was
here at one point.
way back,
That's,
way
yeah,
back, yeah.
I'm losing track of how long ago
Yeah,
that
that
was.
was wild. Okay, McDonald's, and then
Is that just that's just
that's
a
the
renewal?
renewal,
Okay.
yeah. And then the hospital.
Okay.
Okay.
And let's see. Oh, and then this was the emergency thing for the
Yeah.
Beaver Dam.
Yeah,
Yeah.
yeah.
Where is that one located at?
This was
Down
the
by-
one that
Oh, that's the one that.
DPW
Okay, yeah.
needed breaching, yeah,
Yeah.
that had
Yeah.
been discussed.
Mhm.
And then there's the permit for Tiny's, the high school,
Are these, it seems like there's so many of them, does this happen, is
Every year.
every year it's about the
Once a
same
year.
time?
They
Okay.
have to be
Yeah.
renewed by the end of October.
Oh, okay, so that's it.
Wendy's, the Vineyard, okay. And then this is the Lamp and Dragon, and that was the one that had the limited food.
Yeah.
So
they applied for and received?
Yeah, we had,
Yeah.
I think last time we had got a note from her and she said they were finishing up
Yeah.
the process in there.
Yeah.
Tipo Taco, she had just one violation on that. And then, like I said, this is the Lamp and Dragon, Lazy Mary's.
Didn't realize we had so many, huh?
Oh,
Till
yeah.
you hear the
They
roll
add
call.
up. Yeah. They do add up.
Heck, this is. And, Family Dollar, because they have the process. I'm looking at first saying, what the heck is this?
Oh,
Just
yeah, they do.
Chesapeake, Virginia, but that's right, because they have packaged food in there.
Oh,
Yeah, and they have
right.
refrigerated food too.
Yeah,
They have
yeah,
milk
yeah.
and, yeah.
Yeah,
Okay.
yeah.
Yeah. You're right. Yep.
And then Shaker Hill Country Club. And let's see, this is, Parthenon Pizza.
Mhm.
And then the mock program they have from the senior housing, Archer at 70 Main Street. And just looks like the same copy of the Beaver thing. And let's see. Oh, this is the all the stuff from 41 East Main Street that she had signed. Remember, we had looked at, some of this is probably stuff we've looked at before. And then we had a cat exposure in Bennett's Crossing.
Person
Excuse
or
A
me.
what? A cat exposure?
Cat,
Yeah.
excuse me,
Bite.
yeah,
A bite?
Yeah.
yeah. And this is just the same stuff from Mark Watson. Yeah.
Was walk and roll in that stack? Do they?
No, oh, I haven't got there yet. I haven't,
There's a
let me
there's
see,
more.
let's see. And then, this is the, everything that Mark Wetzel wrote up with regards to 41 East Main Street, so
Yeah,
that,
we have those.
yeah, from the July thing. And this all still refers to that, and then we have the, let's see, a draft for the firefighting foam stuff, and this is from, Department of the Army. Expedited site inspection for, yeah, okay. And that was everything in there. Now, I can follow up and tell you that she had received complaints. Of course, this is the first year we've had the trash hauler regs, and it would be down on 10 East Main Street.
Mm-hmm.
That the dumpster, and it's multifamily,
Mm-hmm.
and the dumpster was out too far, and that they wouldn't be able to plow snow, it was gonna be in the way, etc. And this is another one of those cases where, you know, property owners are sometimes not only out of town, but out of state.
Yeah.
And you have to find out who the management company is that's maintaining it. Well, long story short, she kept checking and it turned out that, oh, it's been sold. So they finally, she's working, it's Republic is the
Okay.
trash removal, and she knows
And
Dawn.
they're permitted, right?
They're
They
permitted,
have a
yeah,
permit from
and
the
she
public.
knows him because she's worked with him in other communities.
Oh, okay.
So they've kind of rearranged it a little bit, and she has told them and told the owners of the management company
Mhm.
that if she gets any further complaints, if this doesn't satisfy as far as the DPW and in anybody else,
Yeah,
that they're gonna have to put totes, and the residents are gonna have to be responsible
Yeah.
for bringing them forward.
right.
So that's being worked.
So this is, it's one of those big metal,
It's a big trash
big,
container. but-
okay, okay.
So I said, well, that's okay. So
Yeah.
that's being worked on. The remember back there was a lead paint complaint on East Main Street.
I do.
Yeah,
Yeah.
and that was a long process because they couldn't
Yep.
get in there.
Yep.
You know, she said that the process is going forward, and the tenant has been evicted and will be out of there by January.
Okay.
So that's done, and the Highland Avenue problem, that is being taken care of.
Okay.
Now, you're gonna like this one, Pam. She called me today and she said, I'm over at Vitasoy. Oh, now named Nasoya back.
Oh,
It's back to
yes.
Nasoya
Oh,
again.
That's always a bad beginning.
Yeah, I have,
Yeah.
I have something to add after
Yeah.
you're done.
Oh, boy.
So she said, I apologize to you, Mary, that I didn't get to you last week. She said I was inundated with calls about the odor over there. Now, her process has always been to call Michelle Delmore from
Yeah,
DEP.
DEP, yeah.
Well, apparently Michelle was on vacation, and I guess nobody followed up on any of her calls. So when Bridget called me this morning, she was in fact sitting in front of, it's now Nasoya again.
And that's on Westford Road?
Yeah,
Okay.
yeah.
So she said, and my inbox is filled with complaints. So she headed there this morning on her way in to work.
What happened?
Well, she said the smell is different. It's not like it was before. It's a different type of odor. And she said if I do not get back to you today, she's going to try me tomorrow. But
Yeah.
she said Michelle Delmore was supposed to be in. But whatever they've done, and she said it looked like it was in more the older part of the building.
Okay.
So I said, this is not a good way for us to be starting. So
But a difference.
she said it was different. It was not like what we had before.
But those complaints were last week?
Last week and
she
then
was getting-
today.
And then
Yeah.
today, well, I will tell you, you know where I live.
Yeah.
I live right
Yeah.
across from the pumping station.
Yeah.
We were woken up last night. I got up in the middle of the night, as I always do. I went, what is that
What?
smell? And it was horrible. And I'm thinking, you know, it's the middle of the night. A dog just died. I can't blame the dog.
Oh.
So I'm like thinking, what's going on? So when my husband came in this morning from his bus route, I mentioned it to him and he goes, oh, wait till you step outside. And this was at 6:30 this morning. He goes, it's horrific. And when I left for school, I noticed that I just got out the door and it was like a sulfurous, strong sulfurous smell. And it was coming from that pumping station. We haven't had that problem in a long time. A long, long
And we
time.
have all been, you were over
Yeah.
there. I
Oh,
was
I know,
over
I
there. I mean, Heather was over there.
Wow.
So this is, we were very familiar. But since they
Yeah.
put the new system
Yeah,
in,
we haven't had any complaints.
we haven't had anything, and I thought, I said, where will I tell Pam this?
Yeah.
At the meeting tonight? So, we'll see what happens with that, and I have a feeling that probably one of the selectmen will bring it up tomorrow night. I'm just assuming, so.
Well, something
Anyway.
must have happened in the course of the day. I came home this afternoon, I didn't smell anything.
Well, she
It was
said it was
horrible.
awful all.
Yeah.
Overnight.
It's interesting that it's a different smell and it was in the old part of the building.
That's what she
which
said, yeah.
kind of makes it sound like maybe it was a one-off thing of some other equipment.
I have no idea.
I hate to think that all the new stuff that they put in.
Well, that's what I said to
Is
her. It
not-
doesn't make sense because
Yeah,
after,
yeah.
you know, like, what, a year and a half of complaints,
Yeah,
and then
yeah.
we had that process and everything
Yeah.
was fine.
Everything was going so well.
So,
Yeah, I know. I
Yeah.
mean, this summer we had no problems.
Yeah.
so that was the big thing for today.
Hopefully. that'll be
Just
resolved.
before you got here, we had been kind of reviewing the minutes, and I have a problem with it here. I don't know
Yeah.
if you've had a chance. Well, in here, remember, if you think of the first night of the public hearing for
Yeah.
41 East Main,
Uh-huh, yep,
Mark Wetzel was here.
yes.
And he said that all his questions, and we had the paper,
Mhm.
had been answered with regards to, he was
Yeah,
satisfied.
yeah,
So, there's
Believe
nothing
that's
in
correct.
here about that. And I mean, I think that's an important
Okay.
thing.
Yeah, I
He's
think
the
it is.
DPW
Yeah.
superintendent, and he sat there and
Mhm.
finally he said, is there anything else you need me for?
Yeah.
So, that wasn't done.
Yeah, that should be in there.
So I'm just going to, I think,
Yeah.
and we were just kind of looking at it to say, that's important to have in here.
Yeah, I think so.
Yeah.
I agree with that.
And then the one at the bottom.
And then the maintenance
Remember-
bond, I don't recall, and I remember saying that has nothing to do with us, though. The maintenance bond is not us, it's
Yeah.
the planning board, which we did get into more the final night, I should say.
Well, the maintenance bond would have been us only in that it would have been a bond to make sure that that maintenance schedule was followed in order to make all the aquifer stuff
Right.
work out.
We discussed it, but
Yeah.
it says in here, it says that you made a motion to continue the meeting until the 17th to provide time for the applicant to come back with a maintenance plan to aid the board in setting the amount of the maintenance bond.
And we never,
We wouldn't set
We
the
wouldn't
amount
set a
of a
bond.
maintenance bond.
No, he
We talked.
did have to go
he was gonna.
away and fix the plan because, I mean, if nothing else, the address was
Yes,
wrong.
and,
Yeah.
and because it was getting so late, that's
Yeah.
why we continued it to the
Yeah.
second night.
And I think possibly in the first meeting, when that bond came up, what she may be talking about there is, I think I might have asked him, like, you know, do you have any idea what the cost of, you know, if we had to hire
But
somebody
we
to do this would
definitely
be?
didn't.
Yeah.
No, we
no.
didn't.
We talked
Okay.
about
We
it.
didn't
because
say
I-
that we were gonna
Yeah.
do it, no.
We're in agreement that we need to redo this, because
Yeah, I think so.
and I
Yeah.
think since this was a important public hearing,
Yeah.
that we should have, for
Yeah.
example, Mark Wetzel as our
Yeah,
superintendent and an engineer,
Yeah.
more information in here
Yeah.
that he reviewed and all his questions were answered as
Yes.
far as that.
Yeah.
Okay,
yeah, I think
so
so,
we'll just,
Yeah.
yeah. we can do that.
all right, so I'll just put these back in here and leave it, I'll call her tomorrow morning. So on the quarterly meeting
Yeah,
of the Board of Health, well, you know, we had that whole thing with the amount we have to pay for retirees.
Yeah.
And remember, we had hired a lobbyist to help us. And we had Senator Flanagan that had helped with the first filing, and Representative Harrington
yeah,
testified for the board, and I had said at the June meeting I said, we're not gonna get anything done because this is an election year and
Yeah.
it's a presidential election
Right.
year. They will do nothing.
Yeah, right.
It'll go to study committee, which is the same as throwing it in the wastebasket.
Right, yeah.
So what we all agreed that, we said, whatever your contract with this lobbyist, and it was due to be up soon, we said, don't renew it.
Mhm.
Because that's like putting
Yeah,
a match
yeah.
under your money.
Yeah, yeah.
Neshoba Associated Boards of Health represents 16 communities.
Mhm.
There's a lot of residents in these 16 communities, so maybe what we need to do is call the various state reps and senators that represent us and see if we can get something there. But meantime, Terry's trying to put some money away. But we're a
Yeah.
small
Yeah.
organization.
Right.
We cannot afford to put $500,000 a year away. That's
Yeah.
ludicrous.
Yeah.
So that's kind of how we left that
And
part.
was that an error on the state's part to begin with in what they assessed?
Well, I think
Neshoba
what
had-
happened was that when Neshoba joined, which had been like 30 years before, so
Yeah.
you think there was
Oh,
not
yeah.
that many towns,
Yeah,
you're joining the state. So
Yeah.
you're sending whatever the employee's contribution is,
uh-huh,
and then the state would pay the rest like it does
Yeah.
with other state employees.
yeah.
And all of a sudden, a couple of years ago, some bright person there said, oh, well, no, you're supposed to. The Associated Boards of Health is supposed to be contributing. No, we're part of this
Got it.
state group, so
Got
that's
it,
how,
got it. So it's kind of a status thing. Is
Well,
the
they're
status considered, part
But
of the
see,
state
and
pension
how-
thing, or?
and what's happening, of course, is some of those people are retiring now.
Yeah,
So
yeah,
we said,
yeah.
do what you can, file it again, because now is when you file everything for the new session
Right.
that opens in January.
Yeah,
As far as some of the other things they're doing, of course, they were going in this whole new process, and they moved over to Patterson Road, so smaller space,
yeah,
getting everybody trained to the new way of doing things.
yeah,
And one of the things that they do, because again, if you read the paper, there's so many organizations around now. Years ago, if you were a patient up here at the hospital and you needed some care at home, they'd call Neshoba Associated
Yeah.
Board of Health.
right.
Right.
They're the only game in town.
Yes,
Yes,
that's all they had.
but
Yeah.
now
Yeah.
they're everywhere.
They are.
These
Yeah,
So someone goes up to the hospital every single day. There are presence there to see who's being discharged, who needs help, what kind of help.
yeah,
They also, I think there's a new medical office building in Pepperell. It's some doctors that used to be up here,
okay,
and they're connected with Southern New Hampshire.
oh, okay.
Hospital.
Okay.
So what
okay.
they're doing is getting them to
Yeah.
extend to it.
Yeah, yeah,
With regards, they filled practically all the positions. They were looking for a social worker because, we talked about the fact that people, sometimes both members are older and they're
Yeah.
ill,
Yeah.
and it's all they can do to take care of themselves. And somebody goes in and says, oh my gosh, there's so much clutter in the house.
yeah.
And it's not
yeah.
that they're truly,
Hoarders.
They're
They
not.
can't.
They
They can't.
just-
They can't.
life has got in the way.
Yeah.
Right.
And nobody has been able to tell them what services or how they
Right.
can
Right.
get. The good thing is that there was someone that was associated with one of the private groups, a social worker. She's now started her own business, and she is given time, so she's building up her clients, so when she has hours, she gives it to, Neshoba Associated Boards of Health pay her.
Okay.
So when we had the meeting
That's good.
up till October, Jim said it's really amounting to 2 days a week. So it's
Wow.
taking care of a lot of, so that's, he said we can be, knock on wood that
Yeah,
that's gone.
yeah.
So that's helped a lot.
Yeah,
Yeah.
yeah,
So-
exactly.
I think things are moving along and,
Things are under control, other
well,
than
it's,
retirement.
and then trying to get all these new healthcare regulations, it's
I know.
a problem for everybody.
Yep, I know.
Umpteen forms and,
yeah, it's true.
yeah, so that
I
was,
know.
I think pretty much it was a long going over all, various things and what's going on with trying to fill out these forms and do the,
Yeah,
it's all being run, if you look, it's executives that are running things. The doctor-patient relationship
right.
is gone.
Yeah, that's true.
Absolutely gone.
That's true. That's true.
So that's pretty much that, and then,
Yeah.
so I think that covers everything, and you were going to give us then a report on the,
Well, unless Patricia wants, she
Guess
attended
what?
her first
I
RAB
did.
meeting.
I forgot that, and I was so happy to get it too. I'm like, ooh, this is so
Oh.
professional, and the slides and everything.
It was interesting,
It was
wasn't it?
interesting. The information was, and we were a little disappointed at the text size, Mary, honestly, because of the
Oh,
slideshow.
yeah. Laurie Deering
Yeah,
was
it
all
was
over
tough,
the-
and
Good.
yeah.
Yeah.
But other than that,
Yeah, it was a good meeting, I think, for your first one, because they did do kind of an overview
Yep.
of where they
Okay.
are.
Yep.
Sometimes we have meetings that are very, specific to a particular project, and it's almost like you're coming in the middle of
yeah.
something.
Mhm.
So this was just kind of they did a review of, all the things that are going on, all the different areas of concern. Shepley's, of course, is always a topic. It talked about the fact that they, have done tons and tons and tons of samplings now, and along Scully Road and other places, and I had no idea that Patricia's grandparents were the Scullys.
Great.
So,
Great.
grandparents, which was fascinating, really. So they presented their graphs. I mean, it was a very, very nice presentation. What it all comes down to, however, and I'm going to give this to Jane, I'll bring it again the next time, is the meeting happened to fall kind of right in the middle of some stuff that was going back and forth between Army Corps of Engineers and EPA. So the Army had submitted all of their, and in fact on all of these graphs, they have this disclaimer that the data is currently under review by EPA. This is the Army's interpretation of the sampling. Because all of that had been submitted, this groundwater modeling, to the EPA on October 7th. On the very next day after the meeting, on November 9th, so meeting was November 8th on Thursday, the following day, Army Corps of Engineers was meeting with EPA to discuss all of this stuff. And, I guess we'll get an update at the next round. So the plan, unless they changed it at that November 9th, was that by the end of this month, there's going to be a draft final groundwater flow model. So what all this data comes down to is, they modeled how the groundwater was flowing and what arsenic levels, and now they've put in some additional wells, they keep sampling, and what they're really looking to see is, was that original groundwater flow model accurate or not? And if it wasn't accurate, how should it be amended? So there seemed to be some consensus that, yeah, it does need to be amended. It's a matter of how it needs to be amended. So that was one of their big things. The other thing, though, that was very interesting is this business of PFOAs. So, and then we briefly talked about a couple of the other areas of concern, debris disposal areas, housing areas where there were a lot of pesticides and whatnot, and that, they're still working on those. But this was very interesting. There are these substances, PFAs and PFOAs. They're per and polyfluoroalkyl substances. They're found in Teflon. They're one of the components that goes into making Teflon. They're present in firefighting foams. Is a very common source of them.
I think I've read something in the paper about that recently.
Yeah. What happened was they found, so they've been sampling a bunch of wells. McPherson well, there's 2 wells there. Let's see. Devon's has 3 wells, McPherson, Patton, and Shabkin, I think it is. Shirley has Patterson and Walker. Ayer, we have our 3 wells at the Grove. We were the only one that was above this limit, this health advisory of 0.070 parts per billion of this stuff. So at one well, there was 0.085, 0.018, and 0.103. So they're kind of high readings. The other 2 wells were below. They did point out that, and even when we asked EPA, should we be concerned? What does this mean? And they pointed out that they blend the water from the 3 wells. So in Ayer, unless something very unusual happens and these other 2 wells are down, you're never getting water in your pipes strictly from the 1 well. They just found this. They don't know why. They don't know where it comes from yet. They need to do an investigation. But the craziest thing was, I think, from EPA, and I have a fact sheet here from EPA that we can also give to Jane, and she can put this on our website if people do, hear this and they're interested. This is the thing that I find very interesting, that EPA they've issued this health advisory, but they can't tell you what to do or what it means. It's like you should be aware, there could be some concerns. Now, just because of what I do for work, I've also run up against these chemicals, and they were trying to get them out of the manufacturing of Teflon for quite a while. Didn't succeed because they can't get the Teflon to stick to the substrate surface, so it would be peeling off your pan and you'd be eating it. So the EPA backed off on saying that you have to get rid of all this stuff in manufacturing. So it's in this kind of strange gray area where they think you should be aware of this. I have read, I don't think this says it, I had read some things on my own earlier that perhaps there's some link to cancer or reproductive issues. They don't know of any specific protocols for testing home water filters for the removal of this. So, because somebody had mentioned, it might have been Laurie or someone had said, well, if we use our Brita filter, with charcoal, is that good? Sufficient? And EPA said, well, we can't say that for sure. It might. The problem is that, and this document does a very good job of explaining that this American National Standards Institute, that develops these testing methods for all kinds of different things.
Mhm.
They have not issued a standard yet for testing a filter to make sure that it removes these things. So because there's no standard by which to do the testing, there's no way really for EPA to say, yeah, use a Brita, that'll take care of it, or use this, that'll take care of it. They think it probably helps, and they say in here, yeah, use the activated carbon, which is like a Brita, or reverse osmosis water systems. Change your filters often, if you're concerned about this. And so it was just kind of a, hey, we just want you to know about this. It came up. We have one data point. Don't know what it means or where it's going.
Okay.
So what I would suggest that we do, because it is possible that, some of this information, and so for the folks listening at home, there is not in the water that comes out of your tap at home, that water does not have these substances in excess of EPA's recommendations because of the fact that there are 3 wells and the water is blended amongst those 3 wells before it goes into the pipes. You can use a charcoal filter. If you're concerned, you can use a reverse osmosis system. EPA is most definitely on top of it. They came prepared with these fact sheets for us.
So the fact
so we'll
that
be hearing more.
we have a water treatment plant doesn't make any difference in this?
No, because the water treatment plant isn't really specific to treating this stuff. Yeah.
Okay.
That's more making sure that the water it's pure, it's taking out heavy metals, the things that we know about, microbes, bacteria, that kind of thing. This is really kind of a new thing that's come along, and I believe the woman from EPA even said with a health advisory, it's not like it's dangerous if it's above this limit.
Right.
It's like,
But
we think there could be some concern, we just want you to know.
But even just saying that is enough to get people
That's right.
nervous.
Yeah.
That's right.
So what about these fact sheets, Pam? Is there any way we can, is there some way people, if they are concerned after hearing this, we can
ask Jane. I would suggest that we have Jane post this on, put a link, so get it scanned, put a link on the Board of Health website. So this has not only a little bit of information about this PFOA and PFOS, but it also has some additional links where you can get more information. So if you want to get more information from EPA, there's also a group, it's part of CDC, it's the Agency for Toxic Substances and Disease Registry. They have some information about these perfluorinated chemicals, it's another term for them. So it's just something to be aware of. I think we need to keep an eye on it. I know that EPA is looking for, let's watch this and do some more sampling.
keep that.
Is this extra?
That's the one I brought back and Pam has one.
Yeah, now do we both have the same ones? I think.
I have two.
Yeah, you have 2, I think,
One was back to back, they're both back to back, and
Yeah.
the second one has all the links. Did you have the one with the links on
I
it?
have the one with the links.
All right,
I
so-
think one of yours might be, yeah, for some reason, I only have one of mine.
Okay, so those
So
will
take
go
that
with
one
Mary.
and that one, those are the 2.
Okay.
Okay, and put it in the,
Yeah, have, just put a note on it to ask Jane to get it scanned and put a link.
why don't I just give her a call tomorrow morning
Yeah, that's fine.
instead of,
Yeah, yeah.
no.
And she can call or email me
Yeah.
if she wants to,
Okay,
talk about how we should reference it. And then I can also give her this, because usually when I pick
Yeah,
stuff
and I
up
have
there,
another one I will
Okay.
bring in next
Okay.
This can
meeting.
go to her to put in our
Yeah.
file. So, I use a Brita at home. I'm continuing to use it. I'm not lighting my hair on fire about about this? Like,
yeah.
something I want to watch?
It's
but-
too vague for
yeah.
us to get all that upset about.
It is, and when I started looking into this for work, it's not only in firefighting foams. In firefighting foams, another point that they made is you don't really, firefighting foams are very expensive. So if water will do, they're gonna use water
It's
to
a
put out a
last
fire.
resort.
Yeah, foam is kind of a
Yeah.
last resort. It's only for certain kinds of fires.
It's chemical.
So don't be worried if, you've had a fire put out somewhere, if they used water, it's fine. It's only this foam. And it's also present in a bunch of other, if you have a Teflon pan in your house, you have this substance in your house. So it's not arsenic,
Right.
Yeah,
It's two
but
evils,
it also may not be good. We don't know enough about it really to understand.
Yeah.
Okay,
What
well,
it can do.
in the mail,
Mhm.
there is this information, it's from Laurie Nearing,
Yeah.
and it's all Rich Doherty, and probably a lot of what you
Yes.
just said.
Yeah,
They were.
The EPA and what they
Yeah.
said to Mark
yeah,
Wetzel.
yeah,
Okay,
yeah. Yeah, as I said, the EPA they're really on top of this because they're trying to build their database. So, they said that this stuff it's all over the state, it's cropping up all over the place. So
we're not
they're
the
gonna
old,
stay on
we're
top.
not the
No.
only
No,
one.
no. We happen to be the only one of, the Devon, Shirley, and Ayer wells that happen to have
That.
one well that was above their health advisory. But no, we're not the only community in the state, for sure.
Okay. And that it?
That's it, yeah.
And then the only other thing that was all in here would be, and he was at the selectmen's meeting, and this is an all alcohol liquor license for Keith Layton, the Revival Pub that he wants to
Yes.
put in here.
Yeah,
And Bridget said a bar is considered food service, plans will need to be submitted for the bar
Sure.
area.
yeah.
Is
So-
that the
That's in where,
Hanlon's?
the coffee,
The-
Union
yeah.
Coffee
Oh, the Union
Roasters.
Coffee.
Yeah, in there. So, the only other thing, and you probably read it in the paper, was the Pan Am train.
Yeah.
Yes, our good neighbors, Pan Am.
Yes. Now, the thing is that that happened at 6:30 on a Sunday night.
Yes.
And the first thing when Bridget got into work is Jim said, did you get an email on this? We're supposed to be notified. She never was. Ed Coletta from Mass DEP never notified her.
Mm.
I read what was in the paper and I kept getting a hold of Bridget and saying, look, this
Yeah.
is what's in the paper.
Yeah,
Long story short, I mean, we cannot get too upset. She has been on with the fire chief, and I said, we're supposed to be notified.
right.
That's protocol, though. Those are
Yeah,
our
yeah.
wells.
Yes.
We're in
Yes.
charge of health, and we should have been, and I know that Mark Wetzel said they're putting 4 monitoring wells up in that area,
Oh, good.
just to make
Good.
sure,
Yeah.
because
Yeah.
as they should.
Yeah,
Now, was it a horrible accident? Yes, it was.
yeah.
But I'm not blaming the company that they didn't notify us. It wasn't their job.
Yeah.
But
Yeah,
we should have been notified
yeah.
by Mass DEP. So that's the story on that.
Yeah, that came up as well at the rep, just because we had all the right people
Yes.
there. And pretty much everybody, DEP, EPA, seemed, even Rich Doherty, I think, seemed pretty pleased with the way it was handled, with the amount of soil that had been removed.
Well,
and-
they went right out. I
Yeah.
think it's the notification process.
Right,
And we
right.
don't, because we had a problem many years ago,
Yeah.
and one of our former members had gone to the board and said, wait a minute. She went to the selectmen's meeting, she said, this is us, and we
Yeah.
need to be notified.
Yeah.
Yeah, I mean, they sent her an emergency response team right out there,
Yeah.
the state did, so that.
So at least they did that.
Yes, it just is the notification.
Notification, right. Yeah.
So that's
Absolutely.
the only thing, and they are cleaning it up, the monitoring wells are there.
Yeah, that's good.
And that's
Yeah, that's
where that goes, so,
There was one other thing, is that?
yep, that's
yes.
all.
There was one other thing, it's not really something for us, it's just a health-related thing I thought was interesting, did you also see in the public spirit about the inpatient mental health facility that has opened at Devon's?
I don't get
Terra
the
something.
paper.
Yeah,
Yes.
Terra Nova, Terra Crest, Terra?
Something like that.
Yeah.
Is that is it a mental health or is it a rehab?
I gathered from it that there are going to be 4 units altogether. They've opened the first one, and they were beginning to take patients. I think it's going to have inpatient psychiatric treatment. I think one of the units is going to be like a substance abuse thing.
Addiction center kind
Yep.
of thing.
The last unit to open, I think, is they targeted like February, and that's going to be adolescents. At this point, it's all adult, but there will be an adolescent. So I was talking to Krista about this, and she said this is something that is so badly needed in this area because we have nothing around here for inpatient mental health. That
No.
people either have to go into Boston or they have to go to Framingham or it's a big deal. There's nothing.
It's not just a substance abuse addiction. That's not the only thing they're addressing. There's a psychiatric unit, or is that a different component than?
There was a lot of
so.
talk because I remember when they came to a selectmen's meeting long ago, and somebody from the hospital came down too, because it looked as though, wait a minute, are you trying to take anything from us? We need to be in on this.
A partnership.
Yeah.
Because the other place, Pam, I don't know if you had read about it. There's in Westminster. They've just renovated the. Oh my goodness, I'm losing it. It used to be a restaurant. It's right off of Route 2. You can see it.
Oh, I think I know what you mean. Was that like the old mill or
the
something, or-
Wachusett Inn.
Oh, okay, yeah.
That was bought by RAC, which is RCA, Recovery Centers of America, I thought.
Oh,
And Mike
interesting.
Dugan, who is a spokesperson now for Middlesex County, he had given some
Interesting.
input to that. They are turning that into an addiction in-house outpatient
I
center.
think this is an underserved area.
Yeah,
It
so I
really
know there's
is.
one going in Westminster. There's also in Ashburnham, but that's up that
That's
way.
still
Yeah,
going
that's
up
a
off
ways.
of.
There's
Yeah,
nothing between,
Yeah.
the only other psychiatric would be part of Emerson. So there's really
Yeah.
nothing between
Yeah,
Emerson,
yeah.
between Concord and Westminster or Ashburnham.
This saying, Terra Vista Behavioral Health Center,
Okay,
Mhm.
yeah.
108 bed inpatient hospital providing mental health and co-occurring addictions. Counseling or whatever, then I lost the page after that. So,
So it is
it's
just,
just,
it's a behavioral center it's addiction,
I
and then they must do.
did not get the impression
No?
that it was only, but I could be wrong. That's what I'm trying to figure out here. Is it only 100-bed hospital?
I saw it. Did you see it, Mary, when you drive into Devon's, when you come in?
I never go over there.
No, when you go in through Barnum, and it's right before,
I never go over there.
yeah,
Yeah.
it's right
At
before
all.
Mirror Lake. It's on the other side of the golf course. I didn't know they were up and running. I saw that they were still,
Yeah, they said that they had just opened their first of the 4 total units.
mhm.
So is it gonna be 108 beds total?
Yeah,
Okay.
yeah. That's where it's gonna get to. Yeah, inpatient behavioral health.
Hmm.
So that's where I'm not exactly sure what constitutes behavioral health, if that is.
Well, it doesn't sound like rehab or just
Well-
addressing that one.
It does say here, providing mental health and co-occurring addictions care for
Okay.
older adolescents and adults. And then for some reason, I have a terrible connection because it's not going any further than that. I can only see the very beginning. But at any rate, it's there.
Mhm.
It has the 1 unit open, and they said the final one is expected to open, which I think is gonna be the adolescents in February. So it seems like they're moving pretty quickly to get it
Get
rolled
it
out.
done.
So there's another health provider available,
Right.
I guess.
So-
is how I mention it.
Who is this? It's the name of that company you named is the one that's running it. This is a private.
Yeah, it's a private
Yes, it is.
hospital.
It is
Okay.
private.
Terra Vista?
It's Terra Vista is the name of it, and let's see, had here, also known as Devon's Treatment and Recovery Center.
Oh,
LLC is a psychiatric hospital in Devon's, Mass.
Treatment and Recovery Center.
Oh, now I'm getting a little bit more info here. Yeah, there's info here with the CEO. What is it actually called?
If I can recall what conversations there have been around this, and one of the problems seems to be with, well, some of them that are addicted to opiates or whatever, is that insurance doesn't cover.
Yeah,
And that's a
Yeah.
huge expense. So do you know if anything covers, or is this another one of this is private, so you're going to have, that would be
that
I
I
don't-
interesting to
I
find
have
out.
a feeling when it comes to
Yeah.
insurance with, I know a little bit about this, with these facilities, the lower end of the insurances like the Mass Health, a lot of these private places won't take that kind
No.
of insurance, so it's hard, and then if they do cover you,
Yeah.
they will only do it for so many days and stabilize, and they don't keep you long enough.
Yeah,
And
yeah.
then you can go and you're out on your own, but you come to an outpatient for a couple of weeks. And research shows that's not enough.
Yeah.
It really should be an inpatient program that's up to 30 days, and no, they won't cover it. Maybe,
Well, I
maybe
think most
10.
of the insurances will, from what I
Yeah.
hear.
Only a few days,
Yeah.
like maybe
Yes.
a 7 to 10 days,
I
get
think
used
you'd be
to.
lucky to
well,
get that off your insurance
They
today.
usually will
Yeah.
cover the detox part of it. But then after that, you're kind of like on your own, trying to make sure that you get there
And
for
if
the
you look
outpatient.
at the way
Yeah.
healthcare is going, it's almost as if, okay, you can come in and we'll do your open heart surgery, but
Mm-hmm.
we want you
Yeah,
out of
no,
here in
you're-
2 days.
That's
You
right.
know, I mean,
That's right,
basically,
right,
that's,
Yeah.
you almost
Yeah.
wonder to yourself if, well, I won't be alive to see it, but in another 20 years, will they mostly be day places?
Day
Because
facilities, yeah.
I
the
don't know.
object
It's true.
seems to be, let's get everybody
Get
out
you out
of
of here
here.
as soon as
Which
possible.
is so,
Yeah.
it can be
Yeah,
dangerous.
so,
Well, there's also Health Partners New England is
I know it's a
Why?
fly in here.
Health Partners New England is excited to announce that construction is well underway for our new 108-bed hospital located in a peaceful setting in Devon's, Mass. And this goes on to say Terra Vista. So I think the corporate group is a place called Health Partners New England, not to be confused with Partners Healthcare,
Right.
which
Right.
is
Right.
Mass General
Yes,
and
that
that
whole
whole
group.
thing. Yeah, this is a totally different thing.
But we're seeing 3 different names. You're saying Health Partners New England is the corporate logo, and
Yeah.
then the name of the facility is Terra Vista,
Yeah.
AKA Devon's Treatment and Recovery Center.
Yeah. I'm seeing all 3
Wow.
names here for it. But, you know, stuff you find on the internet too. It's like some of this could be older and, you know. But anyway, there is something, there's, certainly it appears there's gonna be a recovery part of it, you know,
Yeah.
an addictions
Yeah.
part of it. What I don't know is if it's only limited to that, if, you know, that encompasses behavioral health or what else is considered behavioral health it might be.
Right.
Okay, so for the next meeting, I would basically, we need to get the minutes cleaned up and
Yep.
get all that. We got all of, I did in fact go over to Ross's new headquarters over there and just made sure we had all the proper information, their new telephone numbers
Okay.
and all that and everything. And they do have much, you know, it was at the point where I went in and she says, wait till I find what box, because they pretty much hadn't
there's-
even got to, you know,
yeah.
unpacked yet. So you think anything else we need for the next meetings? I think we,
I don't think so. You know, the only thing that came to mind for me was with the ballot question about the animals and having room. I don't think that kicks in for another like 4 years.
I
something.
don't
Really?
know.
Yeah.
I
Wow.
didn't pay an awful lot of question to it, because I'll tell you what I read in the paper. People from the farm said, we don't need this. We already do things properly in this state. So I didn't get too
Some people
concerned
don't.
over that.
Yeah,
I think some
I-
people don't.
Yeah.
Yeah, some do, some don't.
Why would it be 4 years? Why something?
I don't know. I just saw that this morning, and I thought, wow, boy, that's an awfully long time. But I could be wrong. I could be confusing 2 different articles. But we probably should talk to Carlene at some point, and you know, maybe ask her to put that on her plate. Is that something that, you know, now when we do inspections, you know, for
Well,
animals, I think
Let's
we,
see how these regs come
Yeah.
out and what
Yeah,
the
it's
final
just something
thing
to
is,
kind of
and
a
to
heads
put in
up,
the back
yeah.
of our minds
Yeah.
to see what's going to
Yeah.
happen with that.
yeah.
I have a question now that we're legalizing the marijuana.
Oh,
How does
yeah.
that, I mean, that's gonna take a while to implement, right? After how does that go?
Oh,
Oh, that was very fast.
So it was very fast.
They did that so that it went into effect, it goes into effect in December.
Oh,
In December, it's legal to possess. There's like no
That's
longer
correct. So
any
they
civil
didn't wait
penalty.
like you usually do when you have a ballot question. It starts, say, at the beginning of the next
Yeah.
fiscal year.
Yeah.
But you know what? I know that the state, doesn't concern us.
No, it doesn't. They did, I think, they are allowing towns to vote as to whether they will or will not have marijuana retail.
But
shops.
this is totally different than like the compassionate care or the other
Totally
facilities,
different. This
because
is
those are
recreational.
prescriptions.
Right.
This is,
And there's
Yeah.
no way, there's no way for the police to test anything, so
I
if,
know.
so
Yeah.
it's really a,
At that part, the retail is supposed to take effect, I think, January 2018. You can start having retail, so that gives
Oh, so there's
the
nothing.
legislature a year. No, there won't be a
Not-
shop.
no,
You know, they won't be
popping
selling
up.
it at
Yeah.
Pauline's next week. No.
But also, how are they, like, if you get pulled over for a DUI, they have a breathalyzer. Now, what are they gonna do with?
there's nothing.
There's no, you
I
can't blow a
have
THC content into
No.
a,
I have no
there is-
idea.
That's what they said, that
No
is why
idea.
the people that were against it said there's no way to test for that,
Yeah.
so.
Yeah.
Okay, so
Yeah.
anything else? I think we're pretty set for
Think
next
that's it
time.
for
We
the 28th.
just our routine in getting some of these minutes
Yep.
done and whatever goes on with 41 East Main. We've done ours. I
Yeah.
signed the paper. You know,
Yeah.
you have to
Yeah.
wait the 20 days in case anybody
Yeah.
um,
Yeah.
objects to it. But that's all done. So.
Yeah.
okay.
So the only thing that would come back on us there is, I know that he's going for planning board, so if he ends up changing his drawings.
I don't think
Because-
he can't.
I don't think,
He can't. We
Well-
gave, okay,
Right.
we gave
That's what I'm
him
saying.
the permit
Yep.
based on
based on exactly
those
Right.
the
blueprints.
designs
Yep.
that he came
Yep.
back with.
Uh-huh.
Now, if he goes, and I believe he's already been to the planning board,
Okay.
that was my understanding that he was supposed to go. They met last week, I believe.
Okay.
That he was supposed to go to their first meeting,
Yeah.
and what happened, I don't know.
Yeah.
He could not go to the planning board until we had given ours.
Right.
Right.
Now, if they decide that they don't like the plan, as far as we're concerned, he can't change anything that we gave him
That's
the
right.
plans for.
That's right.
So if the planning
Yeah.
board says, no, our site plan said we can't give you this
Yeah.
because for whatever reason, that's fine.
Yeah.
That's up to them.
Yes, it is.
He couldn't go to them until he got a permit from us because it's in our
Right.
health district regulations.
No, I'm just saying
Yeah.
that if, when he goes before planning board, and I don't know if, I'm still unclear as to whether there are any variances he's gonna need for zoning, but if he needs to make changes
He
to
can.
that site plan, well, he can,
Well,
but he's
he
gotta
is.
come back to us
Well,
again.
So the
If
process
it's in-
starts
The
all over.
pro-
It would
Right,
start the
exactly.
whole
Yeah.
long, drawn-out
Yeah.
process.
Yeah.
And
Yeah,
my feeling was that I don't know, I don't want to say anything because I don't know, but the weather is good.
Mm-hmm.
Does he want to start this right away? Although we're getting
yeah.
late because your asphalt places
Right.
close and they
Yeah.
don't really like, I mean, this is
Yeah.
unusual to have this good
Yes.
weather and
Yeah.
we like it.
Yeah.
I'd much rather rake leaves than
Yeah.
shovel snow.
That could change in a minute.
But if
around
this
here.
is getting late into
It
the
is, yeah.
season,
Yeah.
so,
Yeah,
you know,
Yeah.
I don't foresee that they would be doing stuff there this,
I don't.
I
think
can't
so,
imagine them starting to
No.
dig
Yeah.
up ground at this time, and again,
Yeah,
they won't be able to do the roads, and certainly you're
Right.
not gonna want a road dug up or
Oh,
just
God,
primer, you
yeah.
can't have that.
Right.
no, I don't see anything happening until spring.
I don't either.
Yeah. But no, that's the only way that it would end up back in front of us again, is
If-
if he
if he
has to make some
changed it.
changes, then he's
And
gotta
that
go
would
back.
be a huge undertaking and very expensive for
Yeah.
him to
And you
start
have to go
that.
back to Ross Associates, have to
Yep,
consult DPW, all that.
yep.
Everything,
Yeah.
Okay.
Yeah. so.
All right.
all right
Okay.
then.
So if we're all done, I will move that we adjourn.
Okay.
I second it.
Okay, a motion was made and seconded to adjourn. All in favor say aye.
Aye.
So that's